back to the session now, and if you could settle into your seats, we can proceed. Now I'm going to show something on screen. This is a blue hat. I think that'll come on screen in a second. That's all right, Bob. We don't need to worry about the blue hat. I mentioned the blue hat not because it's Halloween, but because there will be a reference to blue hats later in this session. It's important, and I just wanted to give you a heads up. Now, the session on healthcare is being chaired by Brenda Poole. I only recently came into contact with Brenda, but I already recognize her as a kindred spirit, and I look forward to our continuing working relationship. And Brenda possesses a visionary outlook and has a definite inclination to action. That is a potent combination of qualities. I warned Brenda the other day that I was going to report her as a vector for infectious enthusiasm. Well, Brenda is currently pursuing her master's with an organizational development focus. She has a wealth of experience in the healthcare field and is presently the executive director of the Big Country Physicians Primary Care Network, that was the 30th primary care network launched in Alberta when they went live in June of this year. And Brenda has chaired 3 national conferences in her field and a number at the provincial and regional levels as well. Brenda, I'm very pleased that you were able to be with us today. I'm going to welcome you and turn the floor over to you. Brenda.
Thank you. Can you hear me? Can you hear me? We're in Strathmore. Can you hear the audio from Strathmore?
Yes, we can hear you.
Oh, okay, great. Is everyone hearing this?
Yeah.
Okay, perfect. All right. You don't have a picture because I ended up in Strathmore through some very gracious people opening this site. And so you may not see a picture of us, but we're here in body and spirit and mind. And I thank Kevin for such a gracious introduction, and he is a great storyteller. Besides being a fabulous visionary himself, just a quick little note about the Big Country Primary Care Network. We're looking at the opportunity to work with Kevin on a concept that he's developed around utilizing this technology for e-health services. So I'm really excited for us to consider the partnership with that group. And I'd have to say thank you to Kathy and all the education group for so capably articulating the benefits of this technology. And I am really a newbie in this, so this is going to be a great learning opportunity. Now, I won't take much more time here. I just wanted to ask you if you wouldn't mind leaving your mics on mute for now. Send questions through the Illuminate site, and we'll ask that you would hold questions until the end of the presentation. Now, our first presenter is Dr. Chris Serene. Chris is he's got a very long title here. He's a community medicine specialist, special projects, clinical telehealth, lead First Nations and Inuit Health Branch Canada. Now, Chris is going to do a presentation that came from a telehealth forum in Edmonton. And I know from having worked in the First Nations community myself that Health Canada and the First Nations were some of the early adopters of the telehealth technology. So I will turn this over to Chris and look forward to your presentation.
Hello, thank you,